Hello, good evening, everyone. So, welcome to yet another session of Facebook Live. This is me, Dr. Sneha Balki, IVF consultant at Oasis Pune. So, today we are going to discuss about a topic which is something that causes a lot of anxiety in many of our patients who are undergoing IVF. So, what is the most important step of IVF? Of course, the entire journey is full of complex and important steps, but the final step of IVF treatment is embryo transfer, which is the most important day in your IVF journey. So, what happens once your embryo transfer? Now, embryo transfer is something which is a very simple treatment or simple procedure where you're not even given an anesthesia, and as much the little embryo that we have taken so much pain to prepare is ultimately now getting transferred to you. So when you wait for your beta hcg or your reports of IVF, these 15 days are filled with topmost anxiety. There are so many queries in your mind, under your so much of stress, and during this time you are completely clueless about many of the things. So we will discuss today in this session about a few common questions that we get frequently asked by our patients after embryo transfer. So today's topic, we are going to discuss about what are the do's and don'ts after an embryo transfer. So after an embryo transfer, the first 15 days after your embryo transfer, when you are waiting for your beta hcg or your IVF results, what are the things that you can do on your end that will help you maximize your chances of getting a successful result? So there is no per se one thing that will guarantee 100% result, but yes, definitely there are a few things which we can do together as clinicians and as patients that will help us get an optimum result. So let's begin with some basic questions. So first and foremost, many of our patients have a misconception where they are very anxious about their bodily movements. So there is a common misconception that if you scoot down, or if you bend forward, or if you sleep in a particular position, that is going to affect the pregnancy or the implantation of the embryo. So this is not the case. This is just a myth. So, whatever activities that you are accustomed to, whatever the activities you do routinely in your lifestyle, the same activities you can continue doing. There aren't any restrictions per se, and whatever sitting, standing up, lying down, going to the washroom, all these things you can do just as you were doing prior to your embryo transfer. So, any amount of physical stress which you have been accustomed to before your embryo transfer, the same lifestyle, the same activities you can continue. Of course, you do not have to exert yourself where you are lifting heavy weights or doing forward bending and picking up some heavy bags or utensils, something like that. So, those activities which are going to put unnecessary strain on your body related to your abdominal part, those activities, of course, where heavy lifting is involved, should be avoided. uh, Second comes from our working patients who are going to their workplaces routinely. So after often we tell that post your embryo transfer, you need not take a complete bed rest, and immediately the next day you are free to do your household work and your work profile also. So whatever work you have, which is within the vicinity or doesn't involve more traveling within the city, you have to travel, so those job profiles you can very well continue. There are a few restrictions regarding to those women who are in field duties. So might be some women who have field jobs. So those jobs we definitely ask them to discuss with their workplace, with their HR, and try to find a middle ground where the woman does not need to exert herself too much, but she doesn't have to quit her job as well. So, this is regarding the travel part. Of course, regarding traveling, a long distance travel where you are going out of the town, out of the city, or out of the country, those travels, if it's possible, you should try to avoid. Simply for the reason it's not necessarily that it exerts some negative influence on your implantation or your embryo transfer results, but on traveling for longer distances, on doing an international flight travel, or a train travel where you are in a close space with multiple of strangers. So you just make yourself susceptible to acquiring infections from all the people who with whom you are having breathing a common air. So here you get exposed to many infections where if there is a pregnancy itself is going to make you susceptible in acquiring those infections. So those travels, I would suggest that you should postpone at least till you get your embryo transfer results, your beta HCG tape. Of course, if it is inevitable, with the right guidance from your doctor, you can very well continue with that. But yes, do have a discussion about this with your treating doctor. So next and very important part of your post embryo transfer or post IVF, what should be your diet? So I will begin with saying that there are few thumb rules that you need to follow during your entire IVF journey. So during your IVF journey, we advise you to take a healthier diet, make healthier options. So many a times we have had a live session about diet specifically. How do you change your diet? How do you make healthier choices? Is entirely based on our lifestyle. So if there is any faulty lifestyle habits that are going on, we should try to curtail on those, like smoking, alcohol. These are a completely big no during your IVF treatment, specifically after your embryo transfer, because they expose you to toxins and these toxins might hamper the implantation of pregnancy. Apart from this, try to avoid eating out. Even if you do have to eat out, do so from only trusted places where you are sure about the food being fresh and hygienic. Apart from this, the most advisable thing is homely cooked fresh Indian meal. Whatever is being cooked for the family, the same food you can very well have without any restrictions. Certain restrictions to be followed are to avoid hot, spicy, or oily foodstuffs because they might give you a stomach upset and again makes you prone to having an infection. Apart from this, many a times the medications which are going on for you after your embryo transfer make you susceptible to getting constipation out as well. So, if you get constipation already because of your medications, it is only going to increase, it's only going to magnify because of your spicy, oily, and outside food. So, all these things should be avoided and choose a healthier food, whatever is cooked regularly for your family, the same pot you can be used for you. So, another thing, fourth important point is when you are post embryo transfer, you should. Many couples they do ask that during this IVF treatment we haven't had any sexual intercourse. So seemingly a big time has been passed. So after embryo transfer, is it advisable to have sexual intercourse with your partner? So studies show that there are no changes or there is no difference whatsoever whether the sexual intercourse is kept after embryo transfer or not. So, irrespective of your sexual intercourse, your result is going to be what it should be. So, it has minimal effect on your embryo transfer results, but nonetheless, we do advise that you avoid keeping sexual intercourse until at least your beta HCG day. The logic behind this is again the same, because many women do get susceptible or vulnerable because of sexual intercourse. They might get exposed to some sexually transmitted diseases which cannot be treated if there is a successful implantation and an ongoing pregnancy, because pregnancy itself restricts the kind of medications that we can give to the lady, in which scenario the infections or diseases will continue to grow and they won't get treated for a very long time. So we do ask them to avoid all those things. And the ejaculation itself might be a process, might be a situation where infection is transferred inside the uterus. Apart from this, after embryo transfer, the activity of sexual intercourse might even lead to excitement of uterus and lead to uterine contractions. So after embryo transfer, we want the uterus to be in a very static state where there is not much movement going on, so that the embryo settles down in some place and gets implanted effectively. After sexual intercourse, there is contractions of the uterus, which makes it more dynamic, and the uterus doesn't settle. Uterus continues to move, which doesn't allow the embryo to settle down and gets implanted and get implanted effectively. So, sexual intercourse is something that you should be avoiding after your embryo transfer treatment. Now, fifth and important, which I have been stressing about even before in my previous live sessions, is you should not stress about it. So, of course, it is very well understood, because you have gone through a transformative journey during your IVF. IVF itself requires not just monetary, not just time bound, but you need to be emotionally and psychologically also fit. So these things do take a toll, and when you have invested so much, you are bound to be stressed out about the results. Of course, stress is there for everybody, but then how to take that stress or how to handle that stress is something that is still in our hands. So, stress is something that you should regulate. You can do activities that help you enjoy your process, or take support from your family, seek support from your husband. There are a few support groups for IVF which you can find on your social media. You can join those, and these support groups also, by means of sharing their own experiences, do help in relieving the stress that is associated with your results of beta HCG. So this is something that also we need to focus on. Now, apart from this, a minor thing which I know that everybody does follow, but I would still take this opportunity to stress on it. So, after your embryo transfer, you will be given a set of prescription in which there are multiple medications prescribed to you. Now, these medications are there to help you conceive. So, some hormonal balance, the hormone treatment or hormone supplementation, which is required for pregnancy implantation, is provided from outside during an IVF treatment. So, there are a few variations where natural cycle treatments are also done, but in spite of that, IVF pregnancy per se is not something that will be supported naturally. So, the hormones which are required to support the initial phase of your pregnancy will definitely be supplied from the outside in the form of these medications and injections. So, it's very important that you understand your prescription well, you follow your medication timings, and you take it regularly without missing out on any doses. If you need reminders, you can add it on your phone so you get timely reminders and you're reminded of taking those medications regularly. So, what are these are the basic do's and don'ts during your post embryo transfer phase of 15 days. There might be some symptoms also, which, what are the symptoms which can be normally seen? Now, what is something that is normally associated during your post embryo transfer phase? So because we supplement progesterone from outside, so whatever symptoms of pregnancy are also because of progesterone hormone. So, whatever symptoms of pregnancy, such as breast tenderness, nausea, vomiting, fatigue, and some bloated sensation, some sleepiness, some laziness, or drowsiness, are all the things which are associated with progesterone hormone. So, what progesterone hormone does, it relaxes your muscles so that it accommodates the growing pregnancy. But as a side effect, it does relax your rest of the skeletal muscles also. So, because of these, all this treatment, because of this, all these symptoms come up. Also, there is a lot of water retention because of progesterone excess, and this will lead to bloating sensation and breast tenderness. So, one has to understand that it is entirely subjective. Some women do have a lot of troublesome symptoms of the same kind to some degree or the other, and some women take it in their stride and they don't find it very troublesome either. So, if at all such minor symptoms, minor some troubles, if you do have, you have to consult your doctor, and then the doctor will guide you regarding the treatment of the same. So, some mild painkillers or some reassurance might also be good enough to take care of these symptoms. One important thing about your post embryo transfer phase is that you might experience some sort of cramping or some sort of spotting or bleeding. So, what are these things? When should you be alarmed? When should you like? There is nothing worth ignoring in your embryo transfer, post embryo transfer period, but then these two things are something which are definitely alarming for anybody. So, first thing is cramping. So, what is cramping? Cramping is basically the kind of cramps that you might experience before your periods are supposed to come. So one might get suspicious. Okay, I have had my embryo transfer, but then I am still getting the cramps which I usually get before my periods. So is it that my embryo transfer has failed, and am I going to get period soon? So cramps, mild cramps are still there. As I said, uterus is a very dynamic organ, and it is always in a state of contraction and relaxation. So some sort of cramping, some amount of cramping will be there. Again, it is entirely subjective. Some women do feel it, some women might not be able to tell any difference at all. So, either ways, cramping is not something that is only associated with your PMS or premenstrual cramping, but some amount of cramping might be there because we are trying to relax the uterus by giving progesterone. So, it is just the uterus that's responding to these medications. So, in spite of that, rest assured that this is not going to hamper in the results. And another thing which is very alarming for even us clinicians and the patients as well. So, that is some amount of spotting or bleeding. So, what does it mean? Spotting or bleeding? Bleeding is having regular blood flow like you might have during your periods, and spotting is just having a few drops of blood you can see on your undergarments, and subsequently you might feel a little bit alarmed. So, spotting, there are two ways to look at it. Spotting, as clinicians, we do feel that it's a positive sign because when the pregnancy is trying to get implanted in the uterus, it burrows a hole inside your endometrium. Now, whatever blood vessels are supplying blood to your endometrial layer might get exposed, and the blood thinners that we give might make the blood a little thin or watery, so that this minor bleeds also lead to some spotting. But then this minor bleeding is something that is a welcome thing for us as clinicians, because this might this in a way it shows that it is an indication of an implantation happening. So this is what we call as an implantation bleeding. So implantation bleeding in the form of few spots here and there during this first 15 days when you are waiting for your beta hCG can also indicate an implantation bleeding, which is quite normal, and almost 50 to 60 percentage of women who have undergone an embryo transfer do experience some sort of spotting or bleeding in the first 3 months of their pregnancy, the early pregnancy period. But however, I must stress upon that if the spotting is in excess or it is like period blood, in that scenario, you should definitely, this is the only situation where you definitely have to visit your clinic and get yourself examined. And there might be some necessary medication change in this situation while you are waiting for your beta hCG report. So this is all about today's session. So what are the precautions or what are the do's and don'ts that one must take during your 15 days post embryo transfer while you are waiting for your beta hCG? I'm sure I have been able to address to most of your concerns. If still there are any other questions, I would like the audience to please speak up and we can have a discussion regarding the same. So, what are the medications or supplements that one should continue or stop after having the embryo transfer? So, many situations, what happens is after embryo transfer, we already give you a set of prescription, which includes folic acid, ecosprin, which are blood thinners, progesterone in 2 or 3 forms. One will be an injectable, one would be an oral or vaginal capsule, and some patients might be given some sort of gel, vaginal gel also. So these are the medications that are definitely to be continued. Apart from this, few women might have some medications that they have been taking previously, such as medications for hypertension, medications for diabetes, medications for uh, thyroid illness. So such medications, you should let your clinician know beforehand that these are so and so medications that you're taking, because few of these medications might not be safe in pregnancy. So we can, if we know it early, we can do a switch about these medications and choose medications which are safer in pregnancy. So these medication change should definitely be done over. So another question, can I continue with my yoga routine after the transfer? So regarding exercise, like we discussed that there's no need of bed rest. Your travel within the city or with to your job, this you can definitely continue, and exercise. So, exercise of mild to moderate intensity exercises are definitely something that can be done during pregnancy, early half of the pregnancy. Here, I would like to stress about one thing, that any form of exercise, whether it's walking, whether it's yoga, or whether it's pranayama or something like that, these kind of exercise can definitely be done during this time and throughout your entire early pregnancy period also. But do make sure that you are not doing some new exercises which you are not accustomed to. So any exercise which previously you were used to, you are doing it routinely and your body is accustomed to those exercises, any form of those exercise can be continued during this period also. And there is no need to stop doing something that you have already been doing. So if there's a yoga routine that you were doing previously, you can continue with that. Of course, don't do any high intensity workouts like aerobics or Zumba or cardio. Those things are, of course, something that should be avoided. If there are any other concerns, or if you are someone who is going through infertility and you want to have a consultation, there are many queries in your mind. Please do feel free to contact us on the contact number given below on the helpline number for Oasis Fertility. This is me, Dr. Sneha, signing off from today's session. Thank you.